statement, youth prescription drug misuse, root cause, favorable parental attitudes, and then you're gonna have local condition. Parents provide prescription drugs to their kids, right? And then you're gonna map strategies to that one local condition. So what's the first one on there? Providing, you got it, providing information. So what kind of information could we be providing related to this local condition of parents providing to kids? Okay, so who do we provide it to? Provide it to the parents. Okay.
To the parent.
All right, how might we do that?
Give seminars.
Okay, all right, so educate parents. Yep. So that could be flyers, presentations, etc. All right.
So I'm gonna go back to
Community
something.
service, announcements.
Yep. Yeah. Go
So
ahead.
I wanna just, it's all right,
Yeah.
so we wanna provide information, but in your DFC application, you wanna tell the grant reviewer that you know exactly what information needs to go to parents. And I'm gonna go back to what
Yeah.
Judy said yesterday, cause she said perfectly. She said we should have a billboard that has a drug dealer in the street and then a grandmother giving her pills to a child. And that's, we don't all have to do that, but that's the message you want. You want them to know, so what you're trying to do now is, sure, risks, but they probably know the risks. They don't really care about the risks, right? What we want them to know is that it's an illegal act to provide prescription medications because we're trying to stop the behavior. So when you're thinking about providing information, you want to talk about how you're going to disseminate it, but you also want to think about what is the most effective set of strategies is going to change the behavior.
So you're just saying get specific.
Yep, that's exactly. That was a long-winded way of saying get specific.
Get really specific on what you're gonna do.
Yeah.
Rather than just, and it's okay to start there, but create a flyer and give it to parents. You're gonna be more specific on the type of information you're gonna provide. Okay, perfect. Say that again, Robin?
A webpage.
A webpage.
Oh, okay, yep.
Most of these people now are reading more, technology,
Yep, so you could create a web page on the harms of providing medication to your children and list those out, okay? All right, should we go to the next one?
Isn't
What's
that
the
right,
next one?
Judy?
I got you.
That's
I
what
can do
building
that.
skills.
Skills?
Building skills.
Yep, all right. So the question becomes, who are we gonna build skills, like, who do we wanna target in this local condition for skill building?
So,
You want to target? Teachers,
Teachers for parents providing?
you want to take parents, teachers.
How might you
Teaching
build?
kids how to say no thanks. I'm not
Okay.
interested.
Okay, all right, to their parents?
Okay, so we're building skills for the parents to
Well, that's
not
not
do
really,
this.
Yes.
Okay.
You're building skills so the parents to not do this.
Okay, so could we teach them about discarding
Okay,
unused
Yeah.
pills?
okay, so you could
drug take back.
drug take
Drug
back,
take
or
back.
how parents might discard their medication.
disposal.
Okay,
Save yourself, okay.
how do we say that?
Well, we can educate them about a drug take back program.
Yeah.
Because
The importance of
Could
it.
we
and-
So that would
provide?
go with one though,
Then
right?
go with one probably, right? Yeah,
Okay.
What about providing the disposal bags?
Right.
that would, what would that go
Okay.
under? Yeah, that might go into the third
I'm
one.
gonna push back on this.
Yeah.
I'm gonna push back on this. This is where this gets really important. So drug disposal is really important, but if I'm giving my kids
Probably not gonna
my
dispose of
Ritalin or
it.
Adderall,
Probably
right?
not.
Am I gonna say, oh, I'll just stop giving it to them and take it to the take back?
Probably
Right?
not.
So like when we're looking at this specific, but we also wanna see, do I see a solid line between the behavior I'm trying to change and the strategy that we're doing? Does that make sense? Like, sure, we wanna have take back events, but I don't know, actually, if I'm giving prescription meds to my kids, the issue is I don't know where to, it's not like I don't know where to put them, so I'm gonna give them to the kids.
Yeah.
Yeah.
We need
Like-
to look,
right?
So then do we educate them on the harms of doing that?
Yeah,
That
that's,
goes back to the information, right?
right, what I was gonna say is we need to inform parents about the ramifications of giving this stuff to them.
That's
That
it.
The
You
law.
gonna go to jail,
Okay,
That's
or,
it.
and have your kids taken away from you, and or,
yeah.
other, repercussions. Then you're gonna be a pariah in the community, because now everybody knows that you've been giving drugs, to kids or what have you. And so that's what we need to put, I hate to say that, we need to put fear in people's minds that, you know, this is really a bad thing to do.
Yeah.
Cut out the.
Stamp.
Does that build skill?
Can't get public housing.
Does it build skill though?
I know, right?
Right,
Does it build skills though?
right.
So how can we build skills? That means change, not only change what people know, but to give them new abilities to take action.
That's it.
Right. Find other ways.
Could we have parenting classes?
Parenting classes? Yeah,
Yeah.
that's a possibility. What, Dorothy,
Or-
what do you
or
think about that
safety
as a skill
classes.
builder? Parenting classes? You're gonna get the
Parenting
parents.
skills, yeah.
Or safety
Yeah.
class?
So,
Of some sort.
so remember, I think that's a really good idea. So think about, this is where this work gets really fun, because you know what exists in your communities. So we don't need to teach the parenting class, but if we know that there's a strengthening families, if we know that there's a drug
Yeah.
court,
We
if
wanna
know,
challenge
like,
them.
like how do we develop the messaging to build the skills and then disseminate it through our partners? Does that make sense? That, like, I wanna, does that, you know, like, you know where to go, like, you know,
So
disseminate it
collaborate.
through the churches, just, yeah.
Collaborate with different entities to build skills, to
Okay.
help them build skills.
Yeah.
Talks about professional development for teachers and police and
Yes.
others that may be aware of what's happening.
Yep.
and,
Yeah, you
what
could do
they
an
should
ed
do in
service
those
with
instances.
the teachers, the ed service
Yep.
session with them. Tell them what you look for.
Yes.
Yeah.
So you could work with community partners. We could do it through different courses where we're not making our own course, but going out to them and finding out where these individuals might be. Okay?
Well, if we could reach it through the churches, they have different seminars
Yes.
or something like that, because
Yep.
I believe they have more parents, that, you know, that will go to church and will be, will get that knowledge
Yep.
about that.
And then invite Rev over to
Right.
build their skills through the fear of the Lord, huh? that this is illegal, that,
Can
no.
I may have shared this with you, I'm sure I did, so stop me if I'm repeating myself. But so Leslie Gable, who's gonna be the one that's gonna be writing your grants, if you hire her as a grant writer, she coordinates a coalition in New Jersey called One Voice. Did I ever tell you guys about that? And it was from her district attorney, I think. She met with her district attorney, and I don't know, I think it was his idea to try to unite all of the churches. And I know that one of your challenges is bringing all the pastors together across the denominations, but they actually developed their whole coalition about it. It's called One Voice. And so they would develop so one Sunday, you know, there's always fellowship after church, right? So they would bring all the pastors together, members of the congregation, and they would say, on the first weekend in November, at your coffee, in all of our churches, we want to be speaking with one voice. And so this Sunday, we want to talk about this, the dangers of, and so their coalition is called One Voice, because through the faith-based community, they speak with one voice.
That's okay.
Isn't that powerful?
Yes.
England did one, it was called One Cause.
That's
Oh, that's
it.
good.
So, and you guys are masters of organizing your community. So think about how in your community you could take these messages and get it out to the folks think about all the grandparents that are raising grandchildren. A lot of them have their butts in seats on Sunday morning. So think about, like, that's what you want to put in that strategy map, is be as specific as possible what you can do in your community. I love the one voice piece.
That's good.
I love that.
Yeah, yeah. All right, any more thoughts on this one? Should we move on to a third? Providing support? Is that the third one?
Yes.
Support?
Well, let's not and prevention and giving.
So this is just about encouraging people?
Read what's the definition again, say?
So it says, most of us are more likely to act on our knowledge and skills if someone encourages us to, or participates with us. For example, we know we should exercise more, and we may have learned some new exercise skills, but we still may fail to get adequate exercise. However, if we set a time to meet with friends to exercise, or our spouse agrees to exercise with us 3 times a week, then we are likely to follow through and get the exercise we know we need. Prevention puts this principle into practice in many ways, including through peer support groups, alternative activities, and mentoring.
There you go.
Okay.
Support would be mentoring, support,
Talking with them,
Partners.
having being available, right?
Yep. Well, yeah, it could be that. I
But we
mean,
need
think
an
about-
outline of that.
Yeah, that was what we did with the,
Me and to me.
River with last when they interviewed us, that's what they showed. And it was when the church and the coalition came together
I love that.
and did that, we just had, he wasn't here when we did it. He wasn't, Rick wasn't here when we talked about that.
No, well, that's, no, he wasn't, yeah. No, that's a perfect example of partnering. And
You
so,
got to see the interview, you gotta show.
oh,
the
we'll
video.
show it, yeah, I didn't bring my computer up, we'll do that.
So you're just saying that was a good example of an opportunity of providing
That was
support?
opportunity, and Channel 7 came to our church, and we combined with the Change Coalition. And that's what the whole Sunday service was about, Red Ribbon Week.
Okay.
And even the sermon, all the information, and the interview. And that when they came, when both organizations came together, that was one of the things I said. I combined it in the interview, and I said that our bodies, we have to think of it as it is, God's temple, and we have to provide information and learn how to take care of it by not taking substances or any type of drugs or any other substance that will cause us to be unhealthy. So we kind of kept it like that, you know. But people came from all over the town.
It talked about reducing the risk and strategies to reduce the risk.
Love that.
Is there any support if these parents were in our community, they're providing to their young people? I'm trying to think about where I go, and maybe it is Red Ribbon Week where we tie somehow this theme, and we try to, you know, if parents are there at activities, we're trying to tie back to this important issue in our community. We're somehow providing support to them that way. I'm also thinking, like, is there another way to be providing parents support around this that might help them? Again, we give them information, we're trying to build their skills. Like you were saying in that example, like you may know what you need to do, how do we provide some support to them to make sure that that decision that they make now is gonna be different? Anybody can think of anything creative around this?
Well, some schools, when they have parent-teacher conference day, they have situations where they have a paper that the parent comes and checks in an office, they get the kid's schedule, and they have like a little map that they go through where they hit these different places where those teachers are in common areas so that they won't have to be going to individual classrooms. And if they have a place there that they have to go to get checked off, and that parent may win this or win that once they complete their map before they leave. If one of those places is to hit up the table that's dealing with
Youth substance use. or
substance
whatever.
use, that would be a way of getting the message out to parents as well.
That's great. That's great.
So providing support for the parent here or the youth?
That's
Or
interesting.
both.
Yeah, could be both.
If we had a rally of some sort or some kind of function that draw these parents out, and they took his scenario of going
Yeah.
around to different spaces, would that build support for the community, or is that targeting the parent, or is that looking more at the community?
Yeah, yeah.
Yeah.
Well, I believe we target both, that would help the community.
Okay.
Both youth and the parents?
Yeah.
Yeah.
Okay. And we could, it doesn't have to tie in anything, we can create our own space with that.
Yeah. I
Okay,
keep thinking about it, cause I'm going back to what Dorothy was challenging us, is like, if these parents are providing.
They probably have some kind of substance disorder.
Well, and this is where I start to think
More than
about,
likely, if you're giving your youth any kind of prescription medication, I mean, some people just don't know, you know, the dangers, I guess, but majority probably have their own issues going on, and maybe they need that kind of support.
can I ask you, Ashley, is that something you've observed in your profession?
Yeah.
Okay,
Yeah.
okay,
You know, because they're broken relationships, and so the parent who's actively using, oftentimes, that's how the relationship even exists, is
Okay.
to use together, you know?
You know, there's also, I think that's what makes this one, from a prevention standpoint so tricky. I think it runs the full gamut, right? Like, I think you're 1000% right. I also think about the so many families that I know who can't afford healthcare.
Yeah. So you share the medication.
So you share the medication, that community doctoring.
And low
Sometimes
income-
it's nefarious and sometimes it's out of necessity,
Low income areas.
right?
Right.
And healthcare, you know.
Yes.
And the way things going right now at this
Well,
present
I
time.
tell you, you know, you said rally.
mhm,
Let me tell you, I was sitting here thinking about what you said. Now, we got a food crisis. And we got a lot of people, we have food banks, we have churches that give out food. Why is it we can't partner with them as they giving out food? Because, when I was
So we've
over
done
at,
that before.
Put it in the bag.
yeah,
You
where
just
I
put
was
the
at,
information in the food box.
right, that's what I'm getting at.
But do they look at it, you know?
Well, this is the thing, when these people are lining up to receive this food, then you can go out and give them this literature and strike up a little conversation while they're getting ready to, they're in line waiting to receive the food.
Yeah.
That's right, yeah.
And on the
Sit
average,
still.
yeah, they sitting still, because they gonna wait their turn, and the way we distribute the food is that we ask how many people are in your family. So we would load up that much food according to the number of people in the family. So that's gonna give us an idea is that if one car pulls up and they say, well, we got a family of 4, well, we know that we're gonna give this to a person, and in the meantime, they're waiting to get the food, so we're going out talking to them
Yeah.
and getting them lined up and letting them know about there are other things that are associated with this food.
Yeah, resources.
I love that.
And then we're dealing with people that are in a low socioeconomic status to start off with, because they're gonna be the ones that are gonna be selling, have the propensity to sell the drugs, and get the medication, and do all of that. So that would be a good idea of rallying and partnering with people that give out food.
Yeah, and that's brilliant. You know what you made me think of, Rev, too, is that's coming at directly, is, Dr. Martin shared yesterday, and it's true that, you know, you need to hear the same message multiple times before you change your behaviors. So what if you also looked with your local healthcare facilities, that your medical assistant or your physician, probably not the physician, but somebody, when they go for their annual, when they see the doctor, that they're getting screened, do you share your prescription medications, or, you know, counseled not to share prescription medications? Connect with your pharmacies so that when they dispense the medication, we give them information for them to share with the,
That's really hard to do.
Patients.
We just did
Yeah.
a project with trying to integrate behavioral health with primary care. And we asked to do like a 3-question screening, and like they said they were on board, but nobody did.
so, some of this is gonna take a minute, right?
Yeah.
Some of this is gonna take a minute, and you gotta build those relationships.
Yeah.
Here, we all know that, right?
We serve at Breaking Bread
Yeah.
every Sunday morning, the second Sunday morning of the month. And we see folks that, like I say, got questionable drug involvement and things like that. And so it might be a good place to do something there, have it available there at Breaking Bread. They come 3 times a week. They come Friday night, they come Saturday night, and come Sunday morning and have a meal. And,
I think what I get challenged with this is that it's such an individual behavior that as we get down here, it's tough to identify other
A lot of
additional
one-on-one
things. It's a lot of one-on-one.
conversation is what's really gonna
Yeah.
make a difference.
But I think what Dorothy just said that sort of highlighted something for me is in this providing support, which, and I'm going back to this like parent who thinks it's okay to give their child, so just giving them the doTERRA bags probably isn't enough yet anyways, because they're probably not going to use those per se. But I wonder if providing support then becomes similar to Dorothy's example, or providing support to people who are coming in contact with these kind of situations. So whether it's school counselors who are hearing about this, whether it's the pharmacy that could be disseminating information out, whether it could be the ER rooms where young people might be coming in with overdose medication, ER visits and things like that. So when they're dealing with this, we're providing support for them to know what to do or how they might refer, or information that they can be given to parents and families, things like that. So I wonder if they're providing support in that way could look like community partners who are sort of the first line. Maybe it's even first responders. They're showing up to places that they know that they've got information, that there's referrals that are out there in the community that they could be referring parents to that maybe they're unaware of. I don't know. Those are just thoughts I have. Dorothy, does that sometimes fit with your idea that you've seen other communities do?
Yeah, I love that, and so I love all of that. And I think there's some environmental strategies. That's why this is a good one for us to do, because sometimes it is hard to get out of the individual strategy.
Mm-hmm.
Yeah.
But how do we turn it into a policy? I've heard about 6 different policies. We might have a policy with the food bank that one day a month we're going to give out so that becomes a small P policy that's, right? So maybe we can't get in to do screenings with the healthcare facility right now, but maybe we can get an agreement with them that we're gonna put information in the waiting rooms.
Yeah, that's basically where we go.
And then, right, so you know what, it's step by step, right?
Yeah.
So that becomes an MOU, that's another small P policy. Maybe we ask the pharmacies if they don't have time to do the screening, although I'm gonna tell you, it's just my experience, when you can find those pharmacists, cause they see it all in a way that no one else sees it, right? And so, so if you can find a couple of pharmacy champions, like they can be really powerful, cause at point of dispensing, they are seeing a perspective that no one else is
they
seeing.
know when they're coming in for drugs before
They see it all, right?
Yeah.
And they absolutely do, and maybe they don't have time and we haven't gotten, but maybe we could give them materials that they could staple to the bag,
Yeah.
right? And then that becomes an informal policy that we are working with. Just as a matter of my own experience, and so it's just anecdotal, I always find it easier to develop those, relationships with independent pharmacies. So if you've got small town pharmacies,
Right.
the CVS's and the Walmarts, they have to usually go through corporate.
Right.
Unless you find a pharmacist in one of those communities that's just gonna,
Hometown disco pharmacy.
but
what
you
we
know,
got
they're,
And Reed's.
Reed Hutchins Pharmacy, yeah.
So these more policies and procedures, things like that, yeah.
yeah, do you see how we can sort of build those environmental strategies
And it
into
might
some
be
of those?
quasi-informal in the sense that you might not see them as something that might be a policy, but to get something monthly going at the food bank or something like that even, yeah. It's great.
Regularity is the key, I think.
Yeah.
Consistent regularity.
And I think that's the secret sauce of the 7 strategies, especially when sometimes it's gonna be really easy. So for social hosting, we know that we need to enforce or we need to implement a social host ordinance because it's an illegal activity. There's really not much traction that I've ever found to do a social host ordinance around providing prescription medication. Like that would be, I don't know what that would look like. But, so when we're looking at those more individual strategies, I always think about how can I lock it in so it isn't just us doing it all the time? And so that's where those little small P policies, if you remember in week 2, we talked about big P is an elected body, small P are those softer practices, but we still wanna get them in writing. And so I think sometimes with these strategy maps, what we're looking at in providing information, enhancing skills, and providing support, that's a little bit more individualized than we really wanna get, but think about how can we lock it in so it's got more of a bit of an environmental approach to it. So think about, okay, what do we need to, how do we lock that in?
Yeah.
Yeah.
I still like my billboard.
Yeah, the billboard would be good for, I love your billboard,
I
like,
love
why
your
that doesn't
billboard.
exist now, maybe it does,
It
that's
does.
good, that's good.
And I wonder, could billboard actually fit in physical design? Probably too. I mean, that would be a good one. Yep. Yep. I mean, it could be a little bit of both. It's information dissemination, but really be changing a physical design of your community to have a billboard or whatever. So we can put billboards there. So be specific. Again, remember, we always want to make it specific to the local conditions. So it's going to be a billboard of something to do about this theme, not, you know, something related to marijuana in here. That might be for the other substance, but we want to make sure it's tied to that local condition.
Can we put that in the DRC?
What's that?
You can put that into the DRC?
Yeah. Billboard? Yeah,
Do a
sure.
billboard campaign?
Yeah.
Okay.
Yeah.
How
Yeah.
much media campaigning can we do?
How much?
Yeah.
It's kind of up to you, I think. It depends on what your budget's gonna be, if you're gonna do paid media, like a billboard. But, you know, some folks find the local companies that run these billboards and get good deals for them. So, I mean,
Well, if you do a regular billboard, one of the huge ones, the last time I checked, it was $700 a month, so it's probably over $1,000 a month now. But if you do the running billboards, the electronic ones, it's a lot less.
I had a colleague in Iowa working in a coalition, and the one thing they did was they worked with the local drive-through movie theater company, and in the summertime they had all these drive-through movies, and most of the town would come, and they got for free them to put some advertisement up before the theater, before the movie played, and showed it at all the movies for the whole summer. So you just, you know, get creative, and all they did was go and ask the owner, hey, would you do, if our local coalition did a commercial about, you know, some of the local conditions they were working on. Of course, they didn't say local conditions. They talked about the specific issues. Would you air it? He said, sure.
They do that in movie theaters here too.
Yeah. He said, sure, just, you know. And he did it for free. Now, maybe, I don't know, you get it for free, but it was because it was the local person who lived in the community. It wasn't like, I don't know what theaters you get here, but it wasn't like Regal or one of these like big ones, because you end up having to go through corporate and whatnot. But sometimes you get these local folks, these local groups that will do stuff like that, or do it really cheap for you. Yeah, yeah, that's good. All right, what do we got left? Changing consequences, enhancing and reducing barriers. So, anybody think of anything related to consequences we could do related to the local condition? Ashley.
The law enforcement, you know, like, let them know that it's a felony charge, you know, not only to give it to kids especially, but to anybody.
Yep, yep. So inform about the law. Okay. Anything else folks can think of on this one? Risk of losing their life. How could we make that? Can you think of how we could make those an activity or something though? Could we incentivize anyway? Because this is where you can do incentives too, yeah?
And you let somebody speak about what can happen if you're caught doing those things.
Well,
Okay.
and I'm sure
Like
there's
that.
probably an instance of an overdose and a death,
I'm sure, yeah.
where that family member would be like, oh my gosh, what have I done?
Okay.
And then be willing to share that story to prevent others from doing the same. I'm sure there's an instance out there.
Well,
Yeah.
and you know, going back to like churches and stuff, people come when there's food.
Yeah. Oh, that's
So,
great.
So if you're feeding
You know,
them,
if
they're
you're
coming.
feeding them, they're coming, so just have a small dinner type, informative
Yeah.
gathering.
We had people go to the library to get the newspaper so they could scan through and find all the incidents in the week that food was gonna be given somewhere. You know, a meal provided, a potluck, a lunch.
But yeah, but a potluck
They
or
make a
or
weekly
lunch,
schedule and they go to
you
every
know,
one
like
of them.
Oh,
like
my
a lunch
goodness.
and learn,
Yeah. Okay.
where you
Yeah.
provided
Yeah.
lunch and also,
learn.
mhm,
Let's taco about it and feed them tacos.
yeah.
What we do
I did
every
that before.
third, what we do every third
Tuesday of the month, we have a movie night at the church. And we give everything free. And that's when we gonna be passing out these surveys, cause the
Yeah.
community comes in.
Ain't nothing gonna be free anymore.
Nah, well, they get-
I need a survey.
When they come.
We'll be in the survey.
Nothing free no more in England.
For us,
On
it looks like
Thursday
going back
night,
to
go out to
tails and
survey.
crabs.
Alright. I like it, that's great.
I like it, that'll
That's
work.
great.
It goes back to what we've
That's
been
great.
doing.
Cause we don't have a
Mocktails
theater.
and crabs.
Yeah.
The workshops.
What
all
kind of
that.
movies y'all showing?
It's all like the last movie was called Ruth. Y'all heard that movie, Ruth?
Roots.
Root,
Roots.
R-U-T-H.
Oh,
It's
no.
based on
Bible.
the Bible book of Ruth.
Mhm.
How she met Boaz. That's what the movie is.
And the books of the Bible.
And everybody loves it. The kids and everybody, all ages, grandmas, everybody.
Teenagers?
Yes.
Mhm.
From the grandmothers to the teenagers.
Mm-hmm. We had some 10-year-old, 9-year-olds.
Dorothy, I have a quick question. You work with a lot of coalitions around this. Have you ever seen any incentivizing for any sort of drug takebacks that's worked, or have folks ever gotten creative around that to get folks to come out to those?
I have, and now you're gonna make me think, I have seen people do incentives for takebacks.
I just wonder what those could
We
be.
give a flat screen TV away, we have a drawing.
Lord,
Holy
Uh,
moly.
Crowley Ridge
Absolutely.
Development Council, they always
Would
donate.
would something like that count for, like, I'm thinking of these changing
They
consequences.
donated to our sheriff's department, and then the radio comes, and if you come, your name gets in.
I'm trying to think about, is there ways to
Even if you don't
incentivize
put
this?
medication, your name gets in. Goodbye.
so I always think about, how do I, so what is it, so, okay, here's this, my mind is, whatever, not strong. But the way I think about it is, what is the call to action? So what is it I want them to do? So I want them to not give prescription medications to their kids. And I want them to get rid of those medications. Do I wanna do both of those things?
Yes, you
Yes.
want them to
Think
get
you
rid
do.
of them if they're not using
And
them.
if they're not giving them to them, the kids are taking
Okay,
it.
taking them, okay, so. So we want them to lock them up, we want them to destroy them, or, right, either or. And we want them to not give them to their kids.
Yeah.
How do we incentivize to not, the disposal and security piece is easy. How do we incentivize people to not give prescription medications to their
Mhm.
kids?
You share the stories, the heartbreak stories
Yeah.
of what happened when somebody
Kids,
did.
Well, that's not.
So,
that's not in the-
so here's the thing that just is so crazy. Did I tell you guys? I have to tell you this. So speaking about information, I'm going down a bunny trail, sorry. We drove to Florida for my stepdaughter's wedding. And there were speed signs up. But do you think that stopped Eric from speeding? Not only did he get a speeding ticket, he was going 98 miles an hour
Oh my goodness.
and got a reckless driving
That's a biggie.
charge.
Good shit.
Happiest day of my life, because for 10 years I've been scared every time I get in the car with him. He is now driving slow. But my point is, testimonies are powerful, but they don't incite behavior change. And so when we're looking at these strategies, I always think about all of these strategies as an ingredient, but they're not gonna bake the cake. So the stories, the powerful stories that are gonna bring people to tears are the frosting on the cake, but they're not the cake.
They're just for that moment.
They're just for the moment. And so if we see coalitions that are really busy but not getting outcomes, they're the ones that have just convinced themselves that if I just teach and tell, that it's gonna change behavior, but it just doesn't. So the stories are gonna be powerful, but how can we incentivize people to do the right thing?
Punishment's not good either.
Punish not good, no,
Yeah,
punishment's not
'cause
good either.
Punishment's never enough.
So we can incentivize them to take back medications. How do we, Rick, how do we incentivize people to not give prescription medications to their kids?
I know.
Well, like I say, you have the, and maybe it's a sentimental, heat of the moment response, but that grandparent and what tragic thing happened, or someone who's given those by their family. You gotta really create that I mean, sometimes those stories can make a difference, like,
Change the policy.
Yeah, that's what I'm thinking, Michael, is like the stories, absolutely, I hear you, and we need to include them. Is there a way that we can, cause it's already illegal,
And what policy are you gonna change the name of?
Right, so is there a law? I mean, I know there's a law about, passing drugs off, or if someone gets ill or something like that and you're the cause of it or whatever it is, I get that. Could you provide the incentive once something has happened, then go through the tiers of all of this, and if they comply with it, then the incentive is maybe time knocked off of whatever whatever happened. If they comply with it, then the kid goes, back to school or whatever happened, whatever the consequences are for it. If they comply with this plan, then they get lesser punishment for wherever the infraction came in at.
So about role playing, when you got a fake kid going, Grandma.
don't ever make me roll play. That is the quickest thing that'll get me out of a classroom. Sorry, I'm sick, I can't go. I don't know, I think all of these are good ideas, I love all of them, except I don't role play. Julian, yours is, see, this is where we're getting to this is why I love that we're doing this one. That's a really good idea, but it's an individual strategy. It's,
I'm with
so,
all of them that we get.
so how do we, so
But
that's a
they're not
challenge.
equal.
How do we take this and change the environment so the easy choice is the healthy choice?
Like you said, incentives for outdated drugs when you bring them in.
Yep.
Get a gift card to the grocery store.
Yeah.
Right.
There you go.
Yeah.
I mean, I'm liking what
I
you're
mean-
saying. Yeah,
Or that.
love that.
Or a gift card to the pharmacy.
Right.
So in the partnership of the pharmacies or whatever,
Yep.
Yeah.
whatever pharmacy, they take it to the pharmacy that we've partnered with.
There you
If
go.
they take it there,
And the grocery store you
Or-
partner with to get
Right.
a deal on those gift cards.
yeah,
There you go.
yeah.
Yeah.
Maybe get the pharmaceutical companies to chip in some incentives.
Good luck.
Yeah.
Yeah.
They're broke.
Yeah, right.
Yeah, right.
They're paying for all this. They're already giving us.
That's right.
It already gave
Keep
us.
it coming. Keep it coming. No,
I mean, I like those.
I think I love this conversation, cause when Rick and I aren't in the room and you guys are 2 years into your grant, you're gonna have to like take your coalition through these, cause they're gonna be saying, teach, tell. Michael was just brilliant, or like, how do we change the policy, how do we, so you build on those strategies and everybody's brainstorming, and then we try to get them as strong into environmental strategies as possible. That's the power of this. Does that make sense?
The pond, not the frog.
That's
That's right.
yeah.
And actually, you just do this that we're doing with your coalition. That's how you come up with these.
Because, community's always.
So-
number one.
Tell me when your next one is, and I might go in for the flat screen TV. That's pretty good.
That's- yeah.
I like that
Well, we're
one.
at a prevention place in our community donates it.
I'm only giving you
And they pay
Tylenol
for
though.
the radio people to come.
Oh.
I ain't giving you my good stuff though. I'm only giving you Tylenol.
Michael,
Oh.
another good idea, yeah.
We just did that, we had at our church, we needed a flat screen TV. And we went, what was that? And somebody had donated it, and we went to this event, and we did it on it.
Oh,
You what?
We did,
you did it on it.
And we got it for
$140.
The old one or?
Yeah.
The new one.
No.
It's up really good. Yeah.
Wow.
That's good.
You can't find
It was
it.
donated.
It was donated.
But if we be realistic,
What
if we have a grocery card incentive for people to return medications, can we keep up? You know,
Yeah, I believe we could.
can you keep up?
So the tricky thing with returning medications is we have to have law
Yeah.
enforcement there. So you can't just have, Dr. Martin was talking about that and she was right. And there used to be some places where it's not legal to have a drug take back. So once the medications are dispensed by a pharmacy, they can only go back through, a take back, like you can't take them back to the pharmacy.
They're all at the jail.
They're,
And
so
then
they,
so-
there has to be law enforcement presence where they are.
Yeah.
So
Yeah, she said you couldn't have a drop-off box.
not unless it's in a place where there's law enforcement.
Right.
Police
Yeah,
station.
but it's
Wow.
there's a drop-off box
Yeah,
in
yeah,
the home.
that's exactly it.
Anytime you set up with it, anywhere, an officer has to be present with it.
Yep,
You know, we have one in our old hospital
But
building.
it's not active anymore.
Oh, it's not active
But,
anymore.
but you could work with those folks
Yep.
during take back time to plan this out and do it then. I mean, there's
You're
ways
an
around it.
off-duty officer.
and speaking of rural, I know a lot of you come, so I live in rural Wisconsin, and transportation's always an issue, especially with folks with lower socioeconomics. So one of the coalitions I worked with, and then it became quite popular, and so I think lots of folks thought about it, but they would do it with Meals on Wheels. And so, say like the first Monday of the month that they did Meals on Wheels, they would send a card around and said, do you have medications that you need to dispose of? They'd collect those cards, and then the next time they went, they'd bring a sheriff's deputy, and he would be with them, and they would collect on site when they dropped off the meals. And I love that because it fits really nicely into access and barriers.
Mhm.
Yeah.
So it makes it easy for folks to do the right thing. And you could actually add an incentive on there and give them a gift card or something as you do that. But that can be another way to just make it easier for folks to
Yep.
get rid of their medications.
Good one.
I tell you when it's really critical too, I mean, this has just been from my experience. When in-laws die and you have
Yep.
to go clean out their house and there's drugs everywhere.
Yes,
So, I don't know, maybe partnering with the funeral homes and
yes,
saying, would you like law enforcement to come by and pick up all the medication that's,
Yeah.
yes.
yeah.
Yeah, that's a really good one, and another place where, and this was a few years ago, but, I mean, it still is what it is. And we learned last year, we learned that, prescribing rates for opioids in Arkansas were starting to arc back up. So that means that there's drug seekers that are out, that are following that, and so, a couple of things, partnering with funeral homes, partnering with like assisted living facilities, partnering with folks, with hospitals, to give away lock boxes for your prescriptions, for folks that are ill, and then having a mechanism for folks, like a card for people to call when somebody passes, that you can have law enforcement pick it up.
The medication.
Yeah,
And that would fit under this too, probably,
All of
yeah,
it.
barriers, sort of increasing access to that,
Yeah.
those kind of services.
Yeah.
I've seen other communities too that in their, this is probably policy or it could be kind of any of these really, any new builds. Now, it doesn't,
Yes.
again, relies on people to make the right decision, but any new building code requires lock boxes in the
Yeah.
bathrooms for the
Yeah.
cabinetry. So, again, makes it easier for people to make the healthier choice.
Now, and another, I just lost it, come on, sorry. Oh, when they go into the nursing home, they don't usually bring their stockpile from home,
right.
so that leaves it at home.
Mhm.
And if they were multi-generational family, there might be kids that are like, oh, great, last
Mhm.
year.
Yep.
So maybe that's a good time that could be part of a nursing home assessment.
Yes.
Let's
Yep.
get these drugs out of their
Yep.
house.
All really good,
That's
all
good.
really good.
And
The
that
other
could
one-
be providing support to the nursing home staff and facility on how to do that. Could be creating a new policy and procedure where they're asking about that. Could be working with law enforcement somewhere in here too to make sure that, that's followed up on. That's great.
Yep. I was
Dorothy?
gonna say another high-risk group, and I know a lot of you come from the military, well, a lot of times there's pain associated with service, and a lot of times there's mail order prescription medications.
Oh, Lord,
And then
yes.
you take 2 pills and you get a reaction, so they send you a new prescription, but you still have the 90-day supply of the Vicodin. So that's another particular, how do we connect in with that particular population as well to get those medications out of the homes? A lot of times there's children in those homes so I love the way you guys are all thinking and how you're taking the individual strategies and seeing how do we lock it in by pushing them down into those environmental strategies.
Mhm.
Really good.
Definitely true for veterans. I have a brother and he got a stockpile of drugs. I gotta figure out something about that. Cause yeah, they change drugs and then they're just sitting there in his living room and he lives in an apartment complex and, you know, they visit back and forth, so that's just not a good situation.
But I have to do it every 6 months, I have to take mine back to the VA. Ones they send me, I can't handle, I take them back.
Right.
Mhm.
So you're doing you're able to do it and you're doing the right thing, but it just makes it so easy not to do the right thing when you've
Yeah.
got all these medications.
That's right.
So, yeah.
And medications laying around and environmental strategies for that, but parents actually giving the youth, like what is an environmental strategy for that,
Well, I think
you know?
I think that's why this conversation was so important, because the craziest thing is that it's almost impossible for us to control what happens behind closed doors in my home,
Absolutely.
right?
True.
So even if there's a law, I close my door, you don't know what I'm doing behind closed doors.
Right.
So, and I think that's why this conversation was so important. We need to challenge ourselves when we look at the local condition to make those strategies as tight to the local condition as possible. But the caveat is, in your home, nobody can change my behavior. What we can do though, if you look at just the dosage that we talked about veterans, we talked about working with the pharmacies, talking about working with the food bank, talking about working with schools, working with healthcare, working with assisted living. And so if we can lock all of those in so that we're starting to create an environment where in general the community is sort of collectively getting rid of their medications, that's sort of gonna start, yeah, you know? And I think with those, specifically with those local conditions that this is just me as a practitioner, but specifically with those local conditions, I often think about it, we've got all these great strategies, but I can't control what you do behind closed doors in your house.
So with prevention, it's never the frog, it's always the pond.
So that's a good question. 1, 2, and 3, providing information, enhancing skills, and providing support are all individual strategies. And what we just finished, what Rick just walked us through, which was brilliant, was he looked at those individual strategies and he said, how can we also push them down into those environmental strategies? So if we're gonna give information to parents about the legality of prescription medications, how do we lock that in with a policy?
But that's more group-based,
That's more group-based.
like even the 1, 2, 3.
Yep,
Whereas
so we're gonna if we're just gonna educate parents, that's gonna be educate you, educate you, educate you. But if we can sign an MOU with the pharmacies that they're gonna give it to everybody, that now becomes closer to an environmental strategy.
Closer to the pond.
Closer to the pond, because everyone's getting it.
way
Yeah.
different than recovery. You know, prevention.
It's different than recovery.
Yeah.
Yeah.
Cause
Yeah.
we're all about.
And it
Yep.
supports recovery.
Right,
Because
yes.
then these people are gonna be exposed to that too,
I
in
just
the
think I get
community, it's gonna
confused
support the
because it's
recovery.
not really like an individual
Mhm.
Right.
Mhm.
care, you know what I
Yeah.
mean, and we're,
Yeah.
Yep.
I
so
don't
it's
know,
different.
I don't know about
It's a community
schools
vote.
and
That's it.
Can we?
some of them do drug testing to be
Right.
involved in extracurricular things and stuff like that.
That's an interesting one, and I will pull the research, but it was probably a year ago since I looked at the research, but even the American Pediatrics Association does not recommend high school drug testing for a number of reasons. There are some schools that do it, but it's not considered to be like an effective deterrent. And I think sometimes the unanticipated consequences is we're identifying kids that are already really high risk
Criminalizing them at a
and
young
criminalize
age.
them, right?
Yeah.
So
Targeting.
sometimes the kids that may test positive for the drugs are the kids that need to be in those activities more than anybody else.
Yeah.
So, but I'll look at that. I haven't pulled it in a couple of years, but the last time I looked, the American Pediatric Association actually had a position statement not recommending drug testing in high school.
I agree, it probably might be a little hard.
I'm thinking it might. I'll look though. Remind me. Somebody remind me.
Okay.
I just-
Robin and then Julian.
I just wanna ask a question, just for my own information. Is it something in ADHD medication that a person can abuse? Is it something?
Oh, sure.
Yeah.
Well,
It's a
that's
stimulant.
why I asked this question.
Stimulant.
Yeah.
We have a
Most of them
child
have
in
it.
second grade that's not taking his medicine because we believe that the mother is taking his medicine.
Oh, yeah.
Oh,
Oh, yeah.
So I
Highly
told you, when I
diverted.
got out, I'm like, what's in the medication is causing this, because the child's medication is coming up missing, he doesn't have it
Yeah.
anymore.
So
You
you know
should
what,
have it.
you know what the illicit version of that is?
That's what's, that's, that
And
was
people-
the question
people-
answers last week.
People sell them too.
The child is not taking his meds, and the mother,
What's the
the
difference?
child has been
Stronger?
admitted in Riverdale.
Yeah.
Meth
And the mother came
is
to the school
stronger
to
than the
get
ADHD.
his medicine,
Right.
Yeah,
but he didn't need the medicine because he wasn't there.
Right.
If
So
you're
that was my
ADHD,
point.
and
Wait a minute,
it's,
she must be
the
taking-
ADHD
Is she
medicine is
taking
given
this?
to
Well,
help
you
calm
gotta,
you
it
down.
goes back
it's
to,
highly
And then if
diverted.
you
it
use
goes back
meds
to
because
the
you're out
mother
in the
probably
street,
was on the
if you're
medication.
truly
When she was a
ADHD,
child,
it calms
and
you
when
down,
you
it
get
doesn't
18,
keep
they
you
take
up.
you off that
If you're
stuff,
not
and she's
ADHD,
now
then
seeking
it will
drugs,
keep, it's,
and
that's
she
when it keeps
That's
you
what's
understands.
the
up
burden
going
of the
for.
vet.
Well, she
Right.
might, I mean, they're in
So-
a really high risk category now.
To be
Very
ADHD,
high
something
risk.
is
The reason why I
misfiring
say
in
that,
the
make
brain.
that statement,
Okay, and
is
if you
because
take
one
it and
time,
it's not
I
misfiring.
was, when I was working for the
Then-
company,
okay.
I stopped at this convenience store. And I
Thank
had
you.
my name tag on, a company name tag on my coat. And she asked me, what I did, I told her. She said, well, can you get me some medication? I said, well, how old are you? She said, I'm 22. I said, what do you mean medication? She said, well, I was taking medication for ADHD and I've been off of it and I need to get back on it.
Go to the
Seeking.
doctor.
Right, that's what I was, that's what I told her. But she got into it with her boyfriend. She's a big old girl. And she hit this dude.
I love rap stories.
She hit this dude and called the police on him. The police went down the street and they got back into it. She hit him again and knocked him out.
Oh, Lord.
So the police came down and arrested her for domestic violence. All right. Now she was a student at Texas County College, majoring in psychology, and she wanted to be she wanted to work with children,
Oh,
and she couldn't work with children because now
she had a.
she's a
Yeah.
they got her name on the register. You can't work with children.
Oh, God.
Not only that, she can't be a therapist.
No.
Right, couldn't be a therapist anymore.
Well, you can be president.
All right.
Alright, that's another topic.
All right, Julian had her hand up. Yeah, we are at the end of the day. We are at the end of the day. I love y'all. Okay,
So I'm circling back to the ways that
Thank
we
you.
can get,
thank you for taking it back anywhere else.
the ways that we can push the information out. So with us being into the schools, if we pushed out through the schools' newsletters,
Sure.
does that count as environmental?
No, that's
No.
gonna be providing information.
That's providing information, okay,
Yeah.
okay, alright, so then that doesn't.
Here's the challenge
Yeah.
that I find as the theme, and Dorothy, you can say what you want about this. These are easier to do, these are harder to do.
Okay.
These are less impactful because it's 1-to-1-to-1. These are most impactful. What the challenge most coalitions have is they want to believe oftentimes, or they want to just do this because this is easier. Think about how much it's going to take for us to do some of this down here. This could be a multi-year process.
Right.
But if we work on these things and we don't lose sight of the frog or the pond, right? Like we can have a major impact, and we don't have to keep
Right.
going back here and disseminating because we've got policies or we've got these other design changes in place that are going to run themselves and be sustainable over time.
Yeah. Yeah, and the other thing that we see, 100%, and the other thing that we see coalitions do is then stick to those top 3 individual strategies and then get loosey-goosey. So for example, hidden in plain sight, those bedrooms.
yeah.
So I see them, people do them all the time. They're great, but they're goal 1. They're not linked to that local condition. You can say, well, parents or whatever, like, all of a sudden people start justifying their strategies to fit the local condition. I see that in the evaluation work that I do. And the problem with that is you might do the best hidden in plain sight presentation and send it to, have 5,000 people go through it. It's not gonna do anything to change the local condition because it's not connected.
Yeah.
So this work gets most difficult when Rick and I aren't in the room to go, what about? That's where you're gonna, like, you guys have learned so much over these 3 weeks, that's where you're gonna take your coalitions and you're gonna be the one saying, well, what about, how do we turn that,
Yeah.
right? Yeah. It is 4:19. It is time to break for the day. So tomorrow, I think when we start, why don't you